We continue to learn more and more about the cases of monkeypox. According to Global Health, there are more than 260 confirmed and suspected cases in 22 countries that don't normally have any cases of the disease. In the United States, there is one confirmed case in Massachusetts and 7 presumptive cases in New York, Utah, Florida, Washington State, and California.
So here to answer some of your questions right now is Dr. Todd Ellerin. He's a familiar face to you, Chief of Infectious Diseases at South Shore Health. Dr. T, we spend a lot of time, and thank you for joining us, about talking about COVID, but let's shift a little bit to this. What is your concern level about monkeypox in the situation?
Well, Ed, listen, this is obviously an emerging and re-emerging type of infection. We haven't seen many cases. The last outbreak of this was in 2003. What's unusual about this is that we haven't linked the spread to people who've traveled to places or have had animals that have been infected. So we're trying to understand the community transmission. We also haven't defined this as a sexually transmitted infection, and it looks like some of these cases have been transmitted sexually. So that's unusual. So what I would say is I'm not as concerned nearly as with COVID-19, but I think this is there are a lot of mysterious features that we have to figure out.
I'm not the expert, you are, but we've been told that this virus is not easily transmissible. The patient being treated, or who was treated in Boston, has been released from the hospital, but health officials are saying he had at least 200 people come into contact with him. So based on that number, what would you expect to see in terms of spread?
So Maria, you are dead on with the fact that this is not easily transmissible. I expect that most of those 200 will end up being negative and not have to be dealing with monkeypox as the initial case. I do want to say one thing. This was not an easy case to diagnose. The providers at Mass General Hospital really, these were very smart people that made this diagnosis. I can tell you, this wasn't like if you just looked up the textbook of monkeypox. So I think we have to really, I'm just proud to be able to practice in a city that we're able to make this unusual diagnosis.
Dr. T, we know this is in the early days, but experts have been very clear to say this is not like COVID. So why is it not like COVID?
I'm really glad you asked that, Eddie. There's so many features that are not like COVID. First of all, this is not a predominant respiratory illness, and it doesn't have near the infectivity. When you have a single case of the virus that causes COVID-19, you're going to have many additional cases. With monkeypox, it's not like that. Even back in 2003, when we had an outbreak, there were only about 46 cases in the entire United States. And the other really important point is you cannot spread monkeypox before the person develops symptoms. So unlike COVID-19, where you can spread it during that asymptomatic period, that's not the case with monkeypox. So people actually have to have fevers and the lesions before you're spreading it. And again, you really have to have very close contact to come down with this.
All right, Dr. Todd Ellerin in our newsroom. Doctor, thank you so much and be well.
Great to see you, Dr. T.